Hello, welcome back to our new show. You're still watching our signature segment, See the Stories, the choices we make every day from the food we eat, how much we exercise, have a great impact on our well-being. In this modern lifestyle, which is often characterized by fast-paced living and unhealthy habits, has led to a concerning rise of non-communicable diseases or NCDs.
I think it's quite not familiar for me, but I think we need to know more about this. So the catastrophic diseases such as heart disease, cancer, stroke, and kidney failure consume a substantial portion of the healthcare budget through the Healthcare and Social Security Agency or BPJS. And this highlights how individual lifestyle choices can collectively contribute to a massive financial burden on the national healthcare system, underscoring the critical need for preventive measures and healthier living.
Yes, and right now we also see the emergence of autoimmune diseases. We can also talk about this later. And to know more, we have Food Biomedical Nutrition's Corpus Index scientist, Felix Zulhendri, PhD, to talk about building a lifestyle that fights non-communicable disease. Hi, Felix. Thank you for coming to our studio.
Thank you so much.
Welcome back.
Thank you.
Because I believe, if I'm not mistaken, this is your second time.
Yeah, second time.
Previously, he came for the morning show.
Yeah, happy to have you here.
Oh, thank you so much.
I usually watch your reels and also the posts that you make on your social media.
Oh, thank you, thank you.
All the education, yes.
Yeah, and previously we talked about, if I'm not mistaken as well, we talked about your scientific content when you make content about bees and everything. But now we're going to talk about the non-communicable diseases with healthy lifestyle, as we know our title behind us and also behind you, Felix. So actually, what is it about? It's quite not familiar, at least for me. Non-communicable diseases.
So non-communicable diseases are just pretty much diseases that arise, they're not, I mean, it's just through lifestyle. Like lifestyle-induced diseases. For example, type 2 diabetes, obesity, heart disease, stroke, dementia, and that kind of stuff, Yep.
So we can say this is the silent killers?
Oh yeah, for sure. It's not even a silent killer. I mean, it's pretty obvious now, right? Through if you look at the BPJS and all the even in our personal life, you can see that our families, maybe our relatives, they're spending all their assets to the hospital just dealing with non-communicable diseases like type 2 diabetes.
We used to assume that these non-communicable diseases only suffered by those elderly senior citizens, but now we've seen this also suffered by the younger generations. 30-something, 40-something already suffered from these diseases. What happened actually to our lifestyles?
Even our children and adolescents.
Yeah, that's right. That's right.
I just read this. I think it was last week. It was published in this study. I think a small survey in one of the regencies in Bali. 1 in 4 children was actually pre-diabetic or type 2 had type 2 diabetes. 1 in 4. I think it's. We can easily extrapolate that to whole Indonesia. I think it would be fair enough. Yeah. That's in our children. If you look at our, that's 1 in 4. How about in our sort of adults? I would say more than 50% will have some form of non-communicable diseases. Yeah.
What we have done wrong in our lifestyle?
Food choices for sure. Food choices, and it's not. I think the sad thing is that it is not exclusive to urban areas. If we're thinking of these non-communicable diseases, we always think about people living in the cities. I live in a small village in North Sumatra, and it is pretty obvious. Like the situation is pretty dire. Yeah, even in the rural areas. Yeah. Again, food choices. If you go, for example, to a convenience store, I would say 99% is pretty much ultra-processed foods. Yeah. So what is ultra-processed foods? It's pretty much food has gone through a lot of processes with a lot of food additives added into it. High sugar content, preservatives, color dyes, food dyes, and that kind of stuff, Yep.
Yeah, since given your expertise in food, biomedical, and nutrition science, so enlighten our most, continuing Alin's patient, talking again what's wrong with our unhealthy lifestyle. You said that many of us, including us, going easily to the convenience stores, while when we're thirsty, we just
Yeah.
buy easily things that we even do not check it first about the content of, for example.
Yeah, the ingredients. Yeah.
Ingredients.
I think one thing that I always try to spread the words, always check the ingredients. Just look at what are we eating. Just as simple as reading the ingredients. For example, the sugar content, the preservatives, the food additives, the unnecessary food additives. Yeah, just go to just eating real food.
Yes.
Yeah, that will be the easiest, right?
The key of...
Yeah, the key is just eating real food. Yeah.
So what interventions do you think needed, or what measures do you think needed taken by the government? We cannot let our budget,
Yeah. Yep.
what is it, we spend so much money to cure for these non-communicable diseases.
Diseases.
Of course, it's better for us to prevent it,
Exactly.
right?
Yeah. It has to be preventive measures. Go to this is what I've been trying to do. Spread the words in social media. I always go to schools if I've got an opportunity. Just teach our kids how to read ingredients, how to pick better food. Yeah, as simple as that.
In China, they put cooking and nutrition, as a curriculum,
yeah.
and it is obligatory for schools to teach that to students. How about in Indonesia? Do we have to start somewhere, from the parents?
Yes,
maybe?
yes, for sure. Even from our home, right?
Yeah.
Teaching your kids how to cook properly.
Yeah.
I think cooking skills, right, is actually one of the most important in life. If you can cook, definitely gonna eat better.
Yeah.
1000%. Yeah. Once you're able to cook, you're gonna eat better. Yeah.
I do agree with you, Felix. It's not just usual basic skills, but it's we need that skills, right?
Yes, lifetime skills, I think.
Yeah, exactly. Yes.
Because we ourselves who knows what we want to eat, and we, of course our consciousness, we want to eat healthy food.
Yes.
So talking about the rich culinary heritage in Indonesia, sometimes, however, we have a lot of local wisdom that related to the healthy food.
Yep.
But at the same time, we also have a rich culinary heritage that we can assess that actually it could come to this NCDs. So how could you help us to enlighten
Yes.
this two sides of coins?
I think traditional Indonesian food is pretty healthy in terms of the use of spices, right? We know spices. We know spices has a lot of antioxidant,
Anti-inflammatory.
and all those health benefits. But on the other hand, we eat a lot of sugary stuff. The jajanan pasar. Yeah, that's the
reality. Yeah?
That's the reality. Yeah, because that's just pretty much sugar on top of sugar. You're using, for example, rice flour. Right, you cook it with rice flour, and then you add sugar into it. You add food dyes into it, and you're making something like pretty much sugar bomb.
So at least triple a sugar bomb.
Oh yeah, definitely. So the thing is always look up for the traditional food that's full of protein, full of fibers, and then stay away from the sugary stuff. Yes.
So, give us some suggestions, what lifestyle that we can start to adopt, so that we can prevent these non-communicable diseases, including the exercise and then the rest and stress management. Yes.
Number one is that always go for real food. Just ask ourselves. If you look at something in front of us. Okay, what kind of food is this? Is this real food? If it's chicken, it's chicken, right? If it's chicken nuggets, then you got to question it. What is that? And then you look at the ingredients, right? For example, if you want to eat beef, okay, look at it. Oh, this is beef. On the other hand, if you look at beef sausages, what's in the beef sausages? So you got to have a look at the ingredients. But always go to the simpler thing. When you see the real food, okay, just eat it. That's fine, right? They'll be the best one.
Yeah.
And secondly, just stay away from the ultra-processed. I think we're living in an extreme environment at the moment.
Yeah.
If you go to a convenience store, if you go to a supermarket, we as parents and our children, we're being surrounded by ultra-processed. I would say 95 to 99% in all those stores are pretty much ultra-processed. So we got to be aware of it. That's the first thing about food. And secondly, just add in physical activities, exercise. Yeah. I think there's one. I read it somewhere. We Indonesians had the least physical activity one of the lowest rank, right, in terms of physical activities. We don't walk. We go everywhere by cars, by motorbikes, and we don't exercise. And it's translated. You can actually see what's happening with our population. 1 in 3 adults are pretty much overweight.
Right now?
Yeah, at the moment,
Here.
yes.
Wow.
And then if you look at type 2 diabetes, we are ranked one of the highest in the world. Yeah. So yeah, it's pretty obvious.
Yeah. Let's go back a little back to talk about the food. Our staple food, of course, rice, and we also like meatballs. It's kind of processed food, I think. So what is your opinion on it? And also talking about enjoying communal eating and snacking, like...
Yeah, okay, yes. Communal eating is actually pretty good, right? To build a social network, and we're talking to people, and then we're building relations and stuff. Yeah, communal eating is good. But the thing that we have to avoid is just snacking all the time. I think if you think about how Indonesians snack, it's pretty horrible. we eat breakfast in the morning.
Yeah.
Yes.
And then
rice for breakfast in the morning.
Rice, starchy food, right?
Yeah.
Rice, high carbohydrate, high sugar, and then with sweet tea.
Yeah.
With crackers.
With
and
crackers,
chips.
exactly. It's just pretty much carbohydrates with sugars.
Yeah.
And then at 9 o'clock, we have a meeting, work meeting, another snack. At 12, we're gonna eat, for example, another lunch with a lot of rice. And at 2, 3 o'clock, another meeting, or you're gonna meet up with client and stuff. We're gonna snack again. Dinner time. And even before going to bed, you're gonna have another snack.
Yes.
It's just like eating all the time.
Yeah,
so
one
that's
of
the thing
my
that
guilty pleasure. Actually.
Yes, indeed.
Before you going to bed.
Yeah, I think that's the thing that we need to cut.
Yeah.
I eat 3 times a day. That's it.
What do you eat?
Pretty much protein and fiber. Animal protein and
Composition?
fiber. A bit of starch, a bit of carbohydrate.
You still eat rice?
I still eat rice, but I manage it. 2 or 3 spoonful maybe. Yeah, that's pretty much it. So I manage my carbohydrate. If my physical activity is high at a certain time, because I train or I exercise and stuff, so yeah, I'll eat a bit more rice, but I think I still manage it. I think the key is that you manage your sugar and carbohydrate.
Yes. In one of the video that you posted on your Instagram, you talked about how most Indonesians downplay the signs of non-communicable disease, like diabetes, until it's too late. They say it's nothing to worry about. They say like.
Yes. I think this is the sinister part about non-communicable diseases, right? The symptoms change slowly over time, so we don't realize it until it's a bit too late. But whereas like if you get an infection, for example, you get flu or you get like sore throat and stuff, it changes within 12, 24 hours. So you notice the difference. But whereas the non-communicable diseases, you change slowly. And then it makes you think it is a normal part of your life, right?
It's always been like that.
Yeah, it's always been like that. But because it changes throughout the years, so you don't realize it.
Yes.
So that's the thing. Like once you, for example, the easy part will be, how's your visceral fat? That will be the easiest. You can do it at home. It's free. Every time you wake up, and then in the morning before you have a shower, just have a look. How's your stomach?
Yeah.
If it's popping up, then it means that something's wrong. Then you need to change it.
If it's
because
a bit flat, it's good then.
You need to be flat.
Okay.
Yes, that's the thing. Because if you look at the 5 parameters of metabolic syndrome, the number 1 is that the abdominal obesity, which is your
only around the stomach.
Yeah, stomach area. Yes.
So
that's a clear sign.
monitor your belly.
Exactly. You got to monitor your belly because that's the first telltale sign, the easiest and the cheapest, and it's free.
What other 4 signs?
High blood sugar, fasting blood sugar. So either you're pre-diabetic or diabetic. Your HDL is low. HDL below 40 for women and below 40 for men and below 50 for women. High triglyceride level, and then hypertension.
All right.
Wow.
So those 5. Yeah,
Okay.
there's 5 metabolic syndrome parameters that you got to be worried about.
Nowadays, we've also seen like people in our circle got heart attack while
Exactly. Yes.
doing sports, and then some other have stroke.
Yeah.
Such young age. How can we tell the signs that we should be careful if this happened to my body regarding the heart attack or
Yes.
stroke?
Again, your stomach, and then it just monitors your blood sugar and your tension.
Like doing it like the home kit for the blood sugar?
Yeah, it's so easy, right? Yeah,
Yes.
just buy the home kit. Yes, just check whether you're diabetic or pre-diabetic, and then check your blood pressure. Yes.
Right. So Felix, give us some tips, especially for us in the urban area in Indonesia. So finding time for a healthy lifestyle can be a challenge,
Yes.
while managing also stress and also the fast living, as you said. So what is your tips?
For me, it's actually it's in the whole package, right? If you eat well, if you exercise well, you're definitely going to be able to manage your stress well. I think it's all the whole thing. So the thing is that sometimes we don't want to find time. We find excuses, but we don't want to find time. For example, to exercise. If you work at, for example, if you work at from 8 to 5, okay, just exercise in the morning before you go to work or after work, right? That's it, as simple as that. And secondly, always look at what you're eating, what you're putting into your body. I think that's number one. Food for me is actually one of the main contributors to non-communicable diseases. It's not even arguable. It is the main thing that we got to be worried about.
Okay.
Yes.
So what happened among us is, for example, we want to adopt like healthy lifestyle, but it's sometimes, it's just very momentary,
Yes, yes,
We
yes.
don't have like sustainable habits.
Yes.
The consistency, yeah?
Yeah, the consistency and discipline.
I think it's just excuses, in my opinion.
Excuses again.
we gotta,
So no excuses.
Exactly. We gotta build. We need to build the habits, though.
Yeah. Alright.
I know. Habit building will be one of the most important, and then one of the most difficult. Once we're able to build the habits, all the excuses will be gone. Yeah, we'll be able to maintain it, and then find something fun. For example, if you wanna do sports, find something. Find some sports that you feel that it's fun for you, so you can do it longer. Yeah.
Find your fun spot for yourself.
Yeah, exactly, yes.
Okay, so talking about looking at what innovative food or nutritional science interventions are you most excited about, so that could significantly impact the prevention of NCDs in Indonesia?
Yes, I think one of the most exciting development is actually the real food movement.
The real food, okay.
Yeah, the real food movement coming from the States and then from the Western countries. People are starting to realize that the simpler you go, the better it is for you. I think we are not trying to be hippie or whatever, right? Environmental. Yeah, I mean we need to be, because we're living in an extreme environment. But the thing that I'm really excited about is that development. We are going back to the simpler form of what food is. Once we understand that the simpler the better our life will be, for sure. Yes.
Yeah.
No excuse.
No excuse.
Yeah, no excuse.
Start building habits right now. Thank you very much, Felix Zulhendri, for coming to our studio
Thank you
and
so much.
sharing these valuable insights. We really appreciate it. Yes, and then we are now going for another break. So keep it right here on the 2-Hour News Show only on See Today.